My name is Dr. Robert Limoni. I've been practicing orthopedic surgery in Northeast Wisconsin for 19 years. We are going to talk to you about SI fusion surgery. So the sacroiliac joint is located in the back of your pelvis. The purpose of it is it's a connection between your spine and your pelvis and hip joint. An SI joint is vertical, so it's straight up and down in your body, and the forces are more of a twisting and a sliding back and forth. They're supposed to be very limited, only a few degrees in most humans. But as the ligaments fail and the muscles fail to hold it stable, due to sometimes direct pathology to the joint, trauma, pregnancies, or sometimes secondary to effects that a lumbar fusion may have it, or a hip joint that's arthritic and it's forcing motion through it, it ends up sliding or shifting too much. Now, there are some studies that are starting to come into the literature that are associating the SI joint with hip pathology. What they're finding is the majority of people with SI pathology also have a radiographic abnormality of their hip, oftentimes related to that it's misshapen, so it does not, the ball and socket doesn't rotate in its full cycle or completely, so it's overloading the SI joint. This finding is early. We need more studies and research on this, but there's clearly an abnormality or a relationship to this. And as a hip surgeon, I need to know that there's a relationship because I need to be able to diagnose both problems. So in my practice, patients generally come in with different types of complaints. Oftentimes, the SI disorder patients will come in with very acute onset of symptoms. So they'll be functioning fine, going along, and then they'll do something that will set off their problem and get instant electric shocks down their leg or pain in the joint as the muscles are spasming and trying to get the joint back to where it's supposed to be. Some people, it's a positional complaint, so they lay down or they sit and it really jabs them or causes them significant discomfort in certain positions that we all do all day long. A lot of patients with mysterious back pain after lumbar fusions actually have SI pain. The diagnosis is oftentimes made by some classic physical exam maneuvers. Patients with hip pain and SI pain can both present with growing pain. So we certainly don't want to do a surgery on the lesser of the problems for patients because they won't be happy then. And we don't want to treat x-rays either. Hip patients with arthritis oftentimes have a very obvious x-ray, but that doesn't always mean that's what the pain generator is. SI joint pain radiates to so many different areas, so we need to be able to still put all the puzzle together. The iFuse procedure involves placing 3 triangular titanium implants across the SI joint. Because there is some inherent stability in the joint natively by holding it together with these 3 implants, it prevents movement and it allows the implants to grow into your bone over time. Adopting this procedure early is probably one of the most satisfying things that I've had happen in my career. So we did the first SI fusion in 2011, and it was really off the radar at that point. In fact, most insurance companies considered it experimental. And a really cool thing about SI fusion is this concept in surgery had never been done historically. To fuse a joint with an implant like this is very non-traditional, and the results are amazing. If you look at all the other treatments, whether they provide long-term benefit for patients, it's probably like somewhere in the 20s. 20% of people are happy with all the traditional treatments. The results we are seeing is 80+% of people are very satisfied with the procedure, even extending out 5 years later. So now patients have another option that they never were offered before, or they never was even heard of, to solve a chronic problem that was really disabling for people. I've had patients go back to physical activities they haven't done for years. I've had a lot of patients get off drugs that they relied on just to perform normal activities of daily living. And a lot of patients really increased their function and got their lives back. If you currently have an SI disorder or suspect it, we'd be glad to help you evaluate the joint. You can obtain an appointment with us through our website or contact us by phone for consult or evaluation.